So what do we know about how these things work and what it's like to take them? What are the side effects? These all come from big randomized phase 3 trials where the existing prior standard of care was compared to the new option, whatever that might be. So osimertinib alone, monotherapy, was developed and understood based on the FLORA clinical trial, which is a big randomized trial that compared osimertinib, the third generation drug, to getting one of the older EGFR inhibitors. And this was the original old standard of care back, say, in 2015, 2016, 2017, before we had this data. And they were looking at, is it best to get osimertinib first, or best to get one of the first generation drugs first, and then switch to osimertinib later if you had certain types of acquired resistance that suggested continued sensitivity. So they did this big randomized study in people with a classical EGFR mutation with newly diagnosed. And this is what they saw. They showed that you can improve what's called progression-free survival, which is the time on average before someone's disease begins to get resistant and grow on treatment. You can make that better with osimertinib compared to one of the older EGFR drugs by about 8.5 months, 18.9 versus 10.2 months. And this also led to better control of brain metastases because some of our newer drugs, including osimertinib, have more crossing of the blood-brain barrier and therefore are better at preventing disease resistance or progression in the brain, which is quite important. And it did seem, I think, in practice, reduces risk of some of the side effects we saw on some of the older drugs. It's a little more selective against normal EGFR, so you get less rash or other skin-related side effects. Now, just to quickly step back, in case you don't spend a lot of time looking at these what are called survival curves. I'm going to show a lot of them, and they come up a lot when we're talking about how you compare therapies. So how do you read a survival curve? Here's an example: progression-free survival. The vertical axis is people living without cancer progression on their current treatment. So sort of the treatment's working. And the bottom axis there is just time, in this case, time in months. And if everyone's having really fast cancer progression, you're going to see the curve drop down really quickly. We have this in the red line here. On the other hand, in a perfect scenario, if a drug worked perfectly, no one would progress. You have a completely flat green, top line there at the top where no one ever has their cancer develop resistance. And in real life, the curves usually look somewhere like the yellow line. We're trying to shift that yellow line to look more like the green line. So just showing the FLORA data again, you can see the red line was the standard TKIs there, and the blue line moving up was using osimertinib. We also show that this improved what's called overall survival. So this is not how long does someone live before their tumor starts to grow and they have to think about changing treatment, but how long does someone live overall, which is, I think, in some ways, something we're really looking is to extend duration of survival of cancer as long as possible for people. And here we can see that this improved overall survival. I mentioned better CNS control. So this is an example we call waterfall plots, where you can see that by switching to a newer drug, you get better brain response rates. And you can see those bars all drop further. That's the % decrease in brain metastasis size, and you see better response in the brain. So side effects, that's an important consideration for any therapy. EGFR inhibitors have a few very classic side effects. We think about skin side effects like skin rash or dry skin or paronychia, it's like almost like ingrown fingernails. And we think about GI side effects like diarrhea that we often manage with an antidiarrheal. And there are a few uncommon but serious side effects that come up with EGFR drugs like lung inflammation called pneumonitis, or heart side effects like heart toxicity affecting heart pumping function or heart electrical function. So these are things we're watching for when we're treating people with these sorts of drugs.